Hi everybody. In this video we're going to finish up our look at embalming chemicals. Last time we talked about pre-injection fluids and arterial fluids. This time we're going to focus mostly on co-injection fluids. The effects of co-injection fluid is that it's going to hopefully help facilitate our distribution and diffusion. It's going to help us get arterial solution through the arterial system to the capillaries, and then once it's in the capillaries to get past the walls of the capillaries. Should also help to control and enhance the arterial fluid, so to help the arterial fluid do its job, if you will. Recommended amount depends on the co-injection fluid. Some co-injection fluids actually have directions on how to use them. The general rule of thumb is it's an equal amount or half the amount of the concentrated arterial fluid used. So if you have, let's say, 32 ounces of arterial fluid that you used, then you should use at least 16 ounces, maybe 32 ounces of the co-injection. Again, depending on the co-injection, it might actually have directions on how to use it, so look for those. They tend to be on the bottle. We can use most of these almost in every embalming. About the only co-injection that you wouldn't use for every embalming would be humectants. Those are the only ones that are only for special cases. Pretty much every other type can be used in every embalming. We can also use certain co-injection fluids as the vehicle for waterless embalming. Now, waterless embalming is something that's done only in really extreme cases. And the kind of the definition of waterless embalming is injection with embalming fluid undiluted with extra water. So we wouldn't add water to the tank, but we might not necessarily want to embalm the body with just straight fluid. So for instance, I have a floater. I might want to have a really high index. So, maybe a 20 or something like that. But I want to use a 30 index fluid to do that. Well, instead of adding water, I would just add the same amount of co-injection as I would have of water. So the co-injection becomes the vehicle. I do this for jaundice bodies because I want to have a lot of buffers in there, and so I will, instead of using water, inject or mix the arterial fluid with co-injection that has a lot of buffers in it. So looking at the different types of co-injections that you might run across. Humectants are pretty common. These again are things that will help the tissue retain moisture. By doing so, they help to give the tissue a more pliable effect. Very important in bodies like babies that are going to be held. You want that pliable effect. And one of the other things that humectants can do, that it's not on here, but it can help to protect tissue from the harsh reactions of formaldehyde. So in bodies that are dehydrated or even normal bodies, it can help to protect against walling off. So humectants are pretty important in those cases. The common humectants that we tend to use in embalming be things like the glycols, the dihydroxyalcohols, glycerol or glycerin, same thing. That's that trihydroxyalcohol. Sorbitol and its isomers of mannitol and dulcitol, the polyhydroxyalcohols. And also lanolins. Now, lanolin can be a bit of a problem. If you remember, lanolin from chemistry is a wax. It's found in sheep's wool. And lanolin is a very good topical humectant. So for dried out skin, dried out lips, especially if you're embalming people with darker skin, as they dry out, they get ashy. And so lanolin's really good to put on those bodies so that they don't look that way. As an internal humectant, not so good, because lanolin is a colloid, which means if you pump it into a body, it's just going to sit in the capillaries. It's not going to diffuse because it can't get through the semi-permeable membrane of the capillary walls. And so it can create a hypertonic environment inside the capillaries, which is just going to dehydrate the body. That's not something that you would want to do on a body that you're using a humectant on. So avoid lanolins internally. Good externally, not so good internally. And there's different ways to use humectants. Some people will add it to the last gallon of the solution. I think that's silly. So what they mean by that is I'm pumping in 3 gallons into this body. I I've pumped in 2 gallons. On the last gallon, that's when I'm going to add my humectant. The reasoning behind this is silly, but they say that if you put it in the last gallon, it's more likely to sit in the capillaries longer. Well, that's not quite how it works. If that was the case, then why wouldn't we just pump in, 2 gallons of water, flush the system out, and then the last gallon's all preservative? Because it doesn't work that way. So I would never do this. If I'm going to use a humectant, I want to use it the entire time. On normal cases, they suggest you inject humectants under intermittent drainage. Intermittent drainage is when I continuously inject into the artery, but I close off my drainage every once in a while. That helps to build up pressure in the venous system, which gives resistance to the pumping of the arterial solution into the arterial system. Why that helps is it helps to keep the humectant in the capillaries longer, gives it more time to diffuse. One thing about intermittent drainage, though, is you have to be really careful that it doesn't lead to swelling. On dehydrated bodies, they suggest using closed drainage, or technically what we call alternate drainage. Alternate drainage is when I close the vein, so no drainage happens, and I inject about a half a gallon, a quarter to a half a gallon of solution. Then I stop the injection and I open the drainage. And then I close the drainage and I start the injection again. So you never inject and drain at the same time. The reason why they suggest this on dehydrated bodies is the same thing as the intermittent drainage. It helps to keep the humectant in the capillaries, so they will have a better chance to diffuse. But it can also help to elevate facial tissue to normal levels, which can be problematic in a dehydrated body. They tend to be kind of sunken. Problem with this, though, is it can lead to swelling. Now, yes, we want it to swell maybe a little bit, but we don't want it to swell massively. So you have to be really careful if you're going to do it this way. Again, humectants are co-injections that are only used for certain cases. Pretty much all of the rest of these can be used on every case. Things like buffers. Again, buffers are amphoteric. They will act as both acids and bases, and they help the arterial fluid resist the pH changes that go on in the body. Buffers will also help to avoid a jaundice body turning into green jaundice. Some common buffers would be things like borax, which in the old days they actually would just take borax like you find at the store, take a scoop of that and pour it into the embalming tank. We don't really use it that much anymore. Sodium phosphate is a common buffer. The sodium salts of citrates were once used, so sodium citrate was a common buffer back in the day, but then they found out that the citrates are good environments for staph to grow in, and so they kind of stopped using those. Probably the most commonly used buffer is also the most commonly used anticoagulant, which are the sodium salts of EDTA. Again, EDTA stands for ethylene diamine tetraacetic acid. And so the sodium salts of that are pretty commonly used as buffers because they act as both buffers and as anticoagulants. Anticoagulants, again, are there to stop calcium ions in hard water from mixing with the hemoglobin that's in the capillaries, because if calcium mixes with that hemoglobin, it's going to clot up, and we don't want that to happen. Many people mistake anticoagulants with things like hemolysins that break down blood clots. They don't do that. They just stop them from forming. They're also called water conditioning agents or water softeners. Again, different manufacturers will put those on the bottles. It's important that you know what those terms are so you can figure out what's in that co-injection. The common anticoagulants that we tend to see would be the chelates. Those are the most commonly used ones. Those are the sodium salts of EDTA. So ethylene diamine tetrasodium acetate would be the chelate that's most commonly used. Again, there were the sequestering anticoagulants, sodium citrate, the chelates, and the which are just a form of sequestrants. If you remember, will interact with calcium and create water-soluble products, so you don't get chunks floating around in the embalming tank. But the sodium citrate's not used anymore because it was, again, a good environment for staph to grow, so they kind of stopped using it. So the chelates are the ones that tend to get used the most nowadays. Then we have the surfactants. Again, surfactants help to reduce surface tension. We want to reduce the surface tension of the blood that is in the capillaries, because that's why it's in the capillaries, is because of surface tension. If we break that surface tension, the blood leaves the capillaries and we get better diffusion. We'll be able to get more arterial solution in there and get more diffused. These are also called surface active agents. They call them that because, at least in gels, so preservative gels oftentimes have a surfactant in them. It's to break the surface tension in the skin to allow the gel to penetrate better. They're sometimes called wetting agents because that's what a surfactant does. It makes water wetter. They might call them surface tension reducing agents or penetrating agents. The penetrating agents is probably the most common one. Common surfactants would be things like the sulfonates and sodium lauryl sulfate. If you look on the back of a shampoo bottle, you'll probably see something that's very similar to sodium lauryl sulfate. That's a pretty common surfactant. And again, the anticoagulants, the buffers, and the surfactants oftentimes are all in one chemical. So they're all in one bottle. We don't have 3 different bottles that we'd have to mix in to the embalming tank. It's usually one chemical that has all of those. The common one that I use is rectifiant. It's got a surfactant, it's got a buffer, it's got an anticoagulant. And so it's usually just a kind of a one bottle deal for those 3. Lastly, dyes. The dyes are there to help recreate the natural color of the skin, texture of the skin. Again, there are various dyes that they will sell you. Pick one. You're just trying to recreate the color of blood, and everybody's blood is the same. Now, some people will like dyes that are more orangey because of cosmetic lighting. So it kind of depends on the situation. I like to just recreate the natural color. So there are actually different types of dyes. There are active dyes which color tissues. So I would want an active dye in an arterial fluid because that's going to help colorate the body. But you also have inactive dyes. Inactive dyes are there to just color fluids for recognition on the shelf, really more than anything. For instance, cavity fluids. Cavity fluids, I have 3 different cavity fluids in the prep room. One's blue, one's pink, one's green. I don't need to color the cavity. There's no reason for that. Those are inactive dyes because they're just there to color the fluids, so I don't have to read the labels. I can just look up and go, okay, I want the pink one, I want the blue one, I want the green one. Some common dyes are things like eosin. Eosin is kind of a yellow colored, it's red, but it's got a kind of a yellowish tint to it. Not bad for older people to kind of help recreate that high keratin in their system. There's erythrocin. Erythrocin is a red dye. And then there's Pankow red. Pankow red is actually a very cherry red color, but it's an inactive dye. It's non-staining. So you don't really see Pankow red a lot in arterial fluids. That would be more like erythrocin or eosin. Pankow red is more for cavity fluids. Using dyes, they can be added to either the entire volume of the arterial solution, which I would do, because that way then I can use the dye as a tracer for my distribution. So if I see dye show up in the toes, I know I've got distribution to that area. Or much like humectants, you could add them to the last gallon, the idea being that more will stay in the system, which is patently silly, but it's part of the curriculum. I got to tell you about it. Now, one of the things about the dyes, and it's not really in here, but you don't need a lot of dye. Dyes are very concentrated, and so you need just a touch. So at best, an ounce per tank. And if you're doing a smaller tank, then less. You really don't want to use a lot, otherwise they're going to look like Oompa Loompas when you're done. Okay, so that finishes it up for this set of videos. Next set, we're going to start looking at choosing vessels for injection.